So you are interested in reversing your diabetes or preventing diabetes. Now, so there's some interesting things that you can do, and there's a lot of evidence and a lot of experience that people have been having the last few years with this. So it's very interesting that bariatric surgery or weight loss surgery is for actually reversing diabetes. So what's interesting is that as soon as the surgery is done, the diabetes can go into remission. So it's not even about the weight loss because you haven't even lost weight yet, you just had the surgery, but it's stopping the food from going into the digestive tract. So that's kind of like fasting. So if you can do some fasting or just go on a very low calorie, low carb diet for a few weeks, you kind of just resting your digestive tract and your pancreas and all of these organs that are involved in blood sugar control, and you just give them a rest and kind of limit the food, and that can go a long way towards really bringing down your blood sugar numbers and maybe reversing your diabetes. And then from that point on, then you work on how to gradually normalize your eating with portion sizes of your carbohydrates and the type of carbohydrates that you eat so that you keep your blood sugar controlled in the normal zone. Now, some other ways of doing this are to do a low carb diet. And that would be to eliminate sugar, all of the white starchy foods, and maybe even fruit. And this is just temporary for like 2 to 3 months, and some people have found it takes less than that. But 2 to 3 months, you want to limit the carbohydrates as much as possible and limit them to the low carb foods like your greens and veggies, non-starchy veggies, and oops, upside down, and or small portions of lentils. Lentils and beans and maybe a little sweet potato, maybe a little bit of oatmeal, but really, try to stay away from rice and pasta and bread and most definitely sweets during this period of time. So if you can focus on this kind of high fiber, low carb way of eating for a couple of months or so, that also can help you to reverse your diabetes. I have seen patients with being diagnosed with diabetes with an A1C of 11 or 13, and within 2 or 3 months, they've got an A1C that's in the 7s, 6s, or even 5s. So with just really focusing on this kind of aggressive approach to your diet, and then, of course, exercise, really can always help too, because that literally gets sugar out of the blood and helps get fat out of your liver and pancreas so that they can perform more normally. Those are just different ways that you can take an aggressive approach if that's what you want to do to really reverse your diabetes. It is reversible, but you always have to control it. So if you get your diabetes under control, get it down and get your blood sugar back to normal, it doesn't mean then that you can just go back to doing whatever you want. You're always going to have to control how you eat and exercise, but you should be able to modify your eating so it's not strict. You'll just always kind of control your carbohydrates and eat the ones, for the most part, that have the most fiber and nutrition and lower carb. But we can help you with all that. And you can really live a healthy, normal life without diabetes, depending on how aggressively you want to work on it.